All right, we are back here at Atlantic Health Systems, home of Atlantic Sports Health. I am here with Dr. Christopher Hubbard, who's a foot and ankle specialist, surgeon, who's had time in Manhattan and now here at Atlantic Sports Health. Tell us a little bit about the different types of injuries that occur. So many in the foot and ankle, and common injuries in the foot and ankle area.
Sure. Well, first off, Bill, thanks for the opportunity to come out and talk to you today.
Yes.
As an orthopedist specializing in the foot and ankle, I've certainly seen a good deal of sports injury in my 20 years of practice. I've treated the recreational athlete, high school athlete, up to the professional athlete. But to answer your question, some of the most common injuries to the ankle and the foot, probably the ankle sprain is the most common.
Yeah, absolutely.
That's typically an inversion where the ankle turns over. The other type of sprain is the syndesmotic sprain or the high ankle sprain. So that's a little less common. We see different injuries to the tendons about the ankle, the Achilles tendon, ruptures, sprains,
right.
Tendinitis. So injuries to the two tendons on the outside part of the ankle, the peroneal tendons. Those are responsible for the side-to-side mobility and stability of the ankle. See different sprains about the foot, the midfoot sprain or the Lisfranc injury. That's a common injury that we see. See different fractures and stress fractures about the ankle and the foot. The Jones fracture, that's a fracture of the base of the fifth metatarsal. That's a common fracture we see in the basketball, soccer players.
Yeah.
And then probably the turf toe or some of the common injuries we see.
Wow. A lot of potential injuries
Yes.
for the foot and ankle. And many people don't understand when you have a misalignment at the foot and ankle, the chain reaction of that kinetic chain,
Sure.
and how something is off in the foot and ankle, but now all of a sudden you got this back problem.
Sure.
Or a hip injury or a hip hamstring, all because of the foot and ankle. And it's such a complex system of joints and bones. How many bones are in the foot and ankle?
I think there's 26.
26 bones, and I know there are multiple muscles. I knew it was in the 20s. I didn't know the exact. Really amazing in terms of the complexity of how that joint is put together. Can you talk to us a little bit about that high ankle sprain? What is the difference of that high ankle sprain compared to typical ankle sprain?
The high ankle sprains, it's a different mechanism in terms of the foot. So the typical ankle sprain is really the foot turns over. So that's an inversion or a lateral sprain. The high ankle sprain really is what we call an external rotational sprain, whereas the foot's planted. This might be in a football player. The foot gets planted and then they get tackled and their body goes to the side, to the ground, and the foot turns outward.
Yeah.
We see that in a skier where they land and maybe the ski tip gets caught and then the foot and the ankle twists out. So that's typically what we call a high ankle sprain. That's an injury to what's called the syndesmosis. This is the really three ligaments that connect the two bones above the ankle joint. That's the tibia and the fibula right above the joint. And so that could be a sprain where there's no complete disruption, or it can be a complete tear where there's some separation between the two bones.
Sure. And Lisfranc, that's something we're hearing more and more about. Can you give us a little more detail on that?
Yeah, so I mean, Lisfranc can be sort of a general term to describe an injury to the midfoot, but really specifically the Lisfranc ligament is a ligament that connects two specific bones in the foot, really the arch or the central part of the foot. Typically that's an injury where the foot turns over. That again can be a football player gets tackled from behind, gets landed on the heel, and the foot turns over. That sprains that Lisfranc ligament. That can be a sprain where there's no separation between the two bones, or it could be a complete disruption where there are some separations. In those cases, that needs surgical stabilization typically.
Wow. Yeah, I mean, so much complexity and so many things that can go wrong at the foot. We're going to come back in some future segments and we're going to talk more about how can we avoid some of these injuries, how do we recover from some of these injuries, and what are the things we can do to prevent some of these injuries. So that was so informative, and look forward to coming back to learning more.
Great.